Okay, the recording's on now. Hello, everyone, and I'm happy everybody's here today. My name is Tanae. My last name is Brown, and I am the Outreach Interpreter Manager here for the Government Office for the Deaf and Hard of Hearing. And I'm hosting this, and I just want to introduce myself for the program. And we also have Luciana De Mello Marino, and she will be presenting on inside the dental office. And this is interpreters communicating oral health care. We'll go ahead and get
Hello,
started.
everyone. So, before we get started, I'm really curious with all of you. I know interpreters, they're working, but I want to know, do you have experience in the dental office, interpreting in a dental office?
So, so I
In an actual office, no, but in a mock office, yes.
okay, are you comfortable working in a dentist office?
Kinda. Eh.
Yes, no, okay.
Huh.
Okay, so the goal here is to try to make your life easier, to help being able to communicate better, interpret better. So that's the goal for today, okay? And I'm trying to I'll help you guys as much as I can with this information.
Thank you.
Okay, so great. Welcome. Thank you for joining. And I see more people will be joining, but I do have a YouTube post after this. I'll post this on YouTube after this. And so there are four workshop goals today. So it's understanding and communicating the dentist and the dental field. And especially there's all different things that go on in the dentist. Hold on one second. Okay. Also, we will be discussing interpreting and analyzing interpreting and what to do and the strategies that you can use. There's also being able to work together as a team with the dentist and the interpreter. Everybody needs to work together, and that's very important. And then there's also what we're going to be discussing is vocabulary. So dental jargon. So there's no vocabulary today, but just to give you just a basic concept and understanding of how to communicate. Okay. And so, again, my name is Luciana, and this is my sign name. I was born in Brazil, so that is why that is my sign name. Luciana, Brazil, the same hand movement. So I graduated in Brazil um,
As a dentist.
as a dentist, and I've worked for about 15 years as a dentist in a dental office. And I've had experience with patients and so many different treatments
Treatments.
and so many different things within the dental office. When I moved here, life changed, everything changed. Everything was different. And here I became a dental hygienist. So I went from a CBC. And so I started working with the deaf community and deaf dentists and interpreters as a team, everybody working together. And I became so fascinated with that. And also in the dental field, I'm just completely fascinated with the dental field my entire life. And so
I fell in love with the
I
field.
fell in love with the field and I love to work with them. And so I volunteer at the dental school. which was a little complicated because I had a lot of investments and thinking about what to do. So I kind of put that on hold for now. And so I am a hygienist. And I really enjoy my job a lot and understand that Brazil did not have a dental hygienist there. The dentists themselves would do everything in the office. So the good and bad is I still work with the patients and in the dental field, and I enjoy that. But I do see that the deaf, when working with the deaf people, I noticed that unfortunately their experiences are just, they really, I understand what they're going through, and they
They
have
have unique
special needs,
needs.
they have unique needs, and especially with communication. And so I applied for graduate school and for public health. And so I worked to try to help and improve my experience and my skills and for general health. And I tried to focus on the deaf community. Also, um, I work in a baby program. I'm still working and I'm still developing it right now, and there is a lot of work that goes into that. But my project uh, it's called the Deaf Smile Project, and it is to educate the deaf community, the interpreters, and the health professionals about the deaf community, of course.
So, my journey, right? Here's what it is. There's a lot of different perspectives that we have with patients like myself, right? In the dentist fields, with dentists, dental hygienists, both alike, working together with an interpreter. After, graduating, the interpreters, when they come in, we have those, and then you have clinician practice with interpreters and without interpreters. So, just to kind of expand on that a little bit, in regards to my journey, my experience in Brazil, um, no interpreters, no full access, and here's why. So my parents, they never accepted me for being deaf, and so I studied. I studied and I studied. I was in mainstream schools and tried to essentially hide my hearing loss or my deafness. And I tried my best. But also, ooh, just really focusing on the oral therapy was a lot. Kids are playing and playing, and what am I doing? I'm going to speech therapy. I'm, going to, take these additional classes to learn how to talk and more focus on oralism. And it was a challenge, as a kid. But I tried to see the positive from it. Why? And that has really shaped who I am, and that's been my experience thus far. So there's some positives to it. Then I had moved to the States. I moved here, and whew, that was a challenge because now I had to learn English, and it was completely different from my language in Puerto Rico. And I started going through that transition process and I was making mistakes. People were talking and I couldn't understand anything that was going on. I couldn't even speak or anything because there were so many accents here. And in Brazil, people, they have a lot of facial expressions and everything, but here everyone is pretty monotone with their face and the body language is obscure and it's usually a conflict and I didn't understand it. But went ahead through, had a disability advisor and they really helped a lot. Because they really recommended that I start learning, my third language. So, so we started moving into ASL, which Ooh, it really opened up my mind and my worldview, and I started to be able to socialize with the deaf community, and I completely fell in. Like, I was able to see their experiences that are similar to mine, and that was impactful. However, was everything perfect? No. My second counselor that I had, it was complicated. They wanted me to pick two options, right? Interpreter only or a captionist only. And I was like, well, how? How? Like okay, if it's a presentation, okay, maybe that'll work. But in a clinician setting, in a lab, how am I going to be able to understand what's going on? You know, and interpreters are different. But I fought and I fought. My first counselor really helped a lot and helped me understand, the legal aspects of things, my rights, and that really helped a lot. So, being able to start to understand experiences, also putting that hand in hand with utilizing interpreters, both in the clinic, both in the lab, during presentations, collaborating together. Also, I helped just kind of set up the foundation of collaboration within the instructors that were there. And it was a lot. It was nice. I learned a lot, and I'm really sure that the instructors, the dentists, they also learned as well. So I know lectures, classes, labs are completely different because the interpreter can plan ahead. Okay. Also, most of the time, the professors will share the slides beforehand, before they do the lecture. So the interpreters are able to read, review, understand, discuss with deaf clients, discuss about the vocabulary, what does it do, really get an understanding for it. And so that's easier. However, when you're in a clinic, it's more complicated. It's very fast paced. There's a lot of people talking all at the same time, you know, and with dentists, they use gloves, so your hands are covered for everything. At the same time, we need to utilize sign. So if the dentist is deaf, there's a lot of things that are going on, right? And it's different. So now let's go ahead and really start diving into the content for today. In the dental office, you have appointments. Those appointments, they have a process. Now, I understand that the various offices, they have different ways that they approach things. There's a lot, but it tends to follow a pretty similar standard. Okay, so it starts how? So a deaf patient would walk into the appointment, into the office, and they have questions about, medical history. They want to review your medication. If something comes up, if we need surgery, have you had surgery? All of those good questions. And then they want to check for your vitals, your temperature, your blood pressure, things like that. After that, we're going to start, the discussions in regards to treatment. What are we doing next? What are we doing moving forward? We're going to start doing the exam, taking a look at the mouth, see what's going on. After that, then we're, kind of explaining what are your treatment options, or what are we going to do for the rest of the appointment or at the next appointment. There's also x-rays that are included. X-rays, they tend to have x-rays done annually, pretty often, or every 6 months. It really depends on what the patient needs. and that's kind of how the appointments go. Then the treatment itself, and it ranges from patient to patient. If a dentist, they need a specialist, do they just need a dental hygienist? What do they do? Those processes are different. Do they need a deep cleaning? It's different. And at that time, interpreters are pretty much in a rest state. Why? Because most of the time the patients just has their mouth open, and most of the time they don't need an interpreter. But we'll talk about that. After that, after treatment has completed, then it's the education portion. Sometimes it's just discussion, instructions, and what to do next. So with a dental hygienist, we tend to just kind of hold all the information and do the explanations at the end. So that, and then the interpreter starts the process of interpreting once again. After leaving, then they'll go to the front desk and then, they have to deal with their insurance, their payments, next appointment, that kind of thing. So that is the process.
So we do have to understand that in the dental field, there are unique, so they're always different. It could be coming from another doctor, or all these different situations that can come up. So there are a lot of barriers, and we want to, and it does make your job a big challenge, and it can complicate things, and there could be loss of communication and misunderstandings. And normally, those are the barriers that we do have with in the dental field. We tend to use PPE. It's not required. So it is PPE, which is the dentists are required to have a mask, to wear goggles, or a jacket, or gloves. All this personal protection equipment. And it does make a challenge just to see the facial expressions and the body language. And we do hear it so often, the machines, like there's all the machines set up there, and it is very noisy. And interpreters sometimes can't hear specific things and when they're trying to interpret, and it could be a very big challenge. Also, with the dentist, there is a limitation with time. They have a strict time limit, and most appointments are limited, and you have to explain things fast, and you have to interpret something fast and keep it short and try to condense all the information. But interpreters need to understand the information in order to provide it perfectly to the deaf client. So, I'm sorry, hold on one second. I'm sorry. So when you have when you're in the room, you have all the machines set up and things can be very noisy. And so it can complicate things. So also the patients will be laying there. So it's like how to get eye to that person so they can see you. And so the space is limited, the rooms are small, and if you have a little bit more room, it tends to work out perfectly, but most of the time that is not what happens. And also, in the dental office, we do know that many patients do have the dentist anxiety. It is very normal to see that. And people have different body language, especially the deaf community. So, if you have dental anxiety and the patient starts to feel a little anxious, maybe they'll keep it inside, and it's very important that you should be able to notice their body language and how that changes. Also, that creates another barrier with the vocabulary. But I always try to keep a positive thinking, and hearing patients are not able to speak when they're in that position and their mouth is open. They're not able to speak, but deaf people can still sign. So that's not too bad. And so now we can discuss about placement, where to stand and where the best is place for the interpreter to stand. And so it is important. So when you are in the room, you have to notice that where the dentist is, you have to look around where everything is and be able to see where is the best place for them to see clearly. Also, the dentist needs to have access to see the patient clearly at the same time. So we also have lights in the room. And I think now the lights are better. They tend to have goggles that they use often, or like they'll have the lights that are on the head, like the headband, and sometimes on the chair there is the light. So there are very protective now because the light is bright and it comes directly into your face, and sometimes you're not able to see well. So we have to be very careful and make sure that your patient is able to see you. Also, we have the machines. Like I said, the machines are all around the room and it does complicate things. And so if you have a small room, that adds, there's less space. You're not able to touch anything either. And so they're controlled. They're very, very important, and they have strict rules there that you're not able to touch anything, and you can't have any splatter, any infectious things being spread. You don't want anything like that. So you need to be able to manage how to uh, take care of everything and how to move around properly, especially with patients. They do use the goggles, safety goggles, and that either will have they'll be clear or they'll be tinted. So I do know because the light tends to be if it's a little bit darker, it tends to be more comfortable for the patients. But deaf patients, it's really best for them to have clear goggles, and you can request that for the dental team, because we need to be able to see their eyes and to see if they're looking around or if they're squinting or whatever they might be doing. It is important for the interpreter to be able to see that and maintain eye contact with the patient. And then also where to stand, your placement, where to stand in the room. So it is very important that we have, there's three core ideas that we will discuss. So the first one is to be visual. So the patient needs to be able to see the interpreter there. And of course, they need to be able to see the interpreter. The interpreter needs to be able to see the deaf patient themselves and also the dentist. So it's easy for us to be able to look around and interpret and get a feel of the room. And then once you're in, you cannot have any blocking the dentist or the assistant. You can't block them. And you also can't block the table because the instruments are right there. So how is the dentist going to do their job if you're blocking the table with the instruments? So you need to respect the flow of the room. And also, please remember when you're working, again, they're limited with their time. So if you're blocking something, then it's going to be tough for them to do what they need to do. And then also adaptability. The interpreters need to be able to think ahead. They need to be able to think what situations may occur. And sometimes we need to be able to move. And it's very important that we're able to move, and we can't just stand there in one place or sit in one place. So we need to be able to see exactly where the consumer is. And okay, so maybe they can see me if I'm sitting here, from standing over here. So that is very important. Also, we need to be able to move a lot. So you can see the picture on the slide. We have A, B, and C. And so A and B could be very successful if the patient is sitting up forward. So if the patient is laying down, the seat is fully reclined, it's going to be very hard to see, correct? So you're not going to be able to, they're not going to be able to see you. So if the chair is upright a little bit more, that is fine. But we need to make sure that the patient is able to see you eye to eye. In C, many times, this is what is happening in the dental office, and we have to be careful because we need to, the dentist needs to be able to be close to the instruments and close to everything. Also, I wanted to add that it is very important with VRI. I know that many interpreters work in VRI, but there is a lot of discussion about that in the deaf community because dentists and VRI, it is very challenging. And it's very challenging because the, the deaf patient needs to be able to see you, and there creates a lot of conflict with that. It becomes a very complicated situation. So, through my experience, like 3 weeks ago, I went to the GYN, and well, it was I have close relationship with the patient and the doctor. Everybody wants to feel comfortable, and of course you're laying down in that position. So I went to the doctor, um and this is somewhere where I've been plenty of times, and at that time they had a VRI set up, and so it was a very complicated situation because the assistant and the doctor were trying to figure out what to do, where to put the VRI, where to set them up. And so I was just laying there while they were trying to figure it out. I couldn't see the VRI. I couldn't hear what was going on. And it just was a very frustrating situation. And I felt that there was no connection with my doctor in that situation at that time. And we need to have that patient doctor connection there. So we need to think about that.
So, when we think about communication strategies, we want to think about having successful supports, where we can be passing along that information, how we can pull everyone into the experience. And we want to remember that with dentists, they're going to show a lot of things for the patient. How to brush your teeth, how to take care of your mouth after surgery, various things, how to floss. All of that's going to come up. And so you as the interpreter, you have to be thinking about, okay, the client, can they see the interpreter? And at the same time, can they see what the dentist is showing? And if they can't, you have to recognize they can't look at both at the same time. So you need to be able to pause or hold something and say, okay, I'll wait till the dentist shows this. And then when the dentist is done showing it, then I'll go ahead and interpret what was said. Or this is a situation where you have to maybe tell the dentist, okay, we need to stop. We need to take pauses. Um, that can sometimes be super important too, to show, okay, take a pause for me to interpret. So you interpret, then you pause, then they see what's happening. So that communication with the dentist is where you become that team ahead of time. It's really important to have that understanding. That way, dental health, some people have no idea about their dental health. Sometimes people have no idea how to work with deaf people. Sometimes they have no idea how to work with an interpreter. And so they're not sure what to do. So it's really important that we have those conversations and explain, and that we take on that kind of responsibility. I know education is kind of a sticky thing, but it is very important to make your job an easier process and a smoother process. If needed, if you need to clarify something or a terminology that you don't understand or something that you don't understand, it's important that you ask. Ask the doctor again. You know, find out another way. It's super important that you are able to pass along that information. If you don't understand, then you can't interpret it properly to the client. It's super important that this is for, you know, central focus on the communication for this patient. You know, what are you there for? You're there to facilitate the communication, to make sure everyone understands. So that's so important for making sure that you're passing along information. This is for their health. This is for the patient's health. You know, if they don't understand something or you misunderstand it, it can really cause damage. So it's very important that you know what you're interpreting. And you do have to adjust, you know, that internal range to make sure that you're meeting those clients' needs and how you interpret. That you have to adjust to meet their language needs. You know, if somebody comes in signing with amazing, you know, their signing skills are very high in terms of ASL, that's one thing, versus if they're looking for more English translation. You have to be able to do that range and provide that. Before, we mentioned that, you know, we're not teaching terminology. That's not our job. But I do want to help you understand, just to make it a little bit easier, some of these terms. I just threw a few terms on here that are pretty common. So the first one, cavity, caries or decay. They're different, but we do use kind of pretty standard words for those. So most of the time, what you would do is you're going to spell it first. You can abbreviate it. You can make a not sign with a C going forward. The important thing is that you finger spell it first to set it up, and then you can sign cavity going forward like this. If you have a client that's okay with that, few of them won't accept it, but typically that's fine. Once you've established it, it's okay. Tartar or dental calculus. It's more of an official name. It's a specialty term. It's not used very often in just general conversations with the patient. But tartar, you're again going to finger spell that most of the time. Filling, you'll see 3 different options for those. Filling like this, filling like this, or filling like this. So those 3 you see pretty regularly. Crown. There's 2 there. Crown like this or crown like this. You see those 2 signs for crown. Bridge. This one's interesting. So bridge, you'll see that, but you do need to expand it and explain it, right? So I'm not building an actual, you know, bridge, right? It's a bridge between the teeth. So how do you explain that? You can sign bridge. And then like, for example, if the dentist wants to extract these 2 teeth in between, say, oh, you need these extracted. And then there's a gap. What do? For chewing, things like that. You need help. You need something there, right? Between those 2. Crown, crown, and then fake right here. That's the concept of a bridge. So they need to understand that basically the concept is there. What's the theory? So you have to explain that so they can visualize and say, oh, okay, I understand what's about to happen, and then interpret that. Extraction, right? We just talked about that. Gum disease. That's important to know. Gum disease is like, that patient, it's a patient terminology. It's not a specialist. So when they're talking about, oh, you have some light gingivitis. If the patient is ignoring their brushing or not flossing, they're like, I don't care, then it becomes worse. And then it becomes periodontal or periodontitis. Periodontitis. You can do PERO for periodontitis. You can abbreviate it that way. Not just a P, but do PERI, periodontitis. Dental cleaning. We have two ways. Like this, manual cleaning. You can use equipment to brush or flossing in between, right? Or power cleaning. What is power cleaning? So for that, you want to envision, you have a machine in the office. There's a machine, and they have a tip, and there's a metal piece, and it vibrates with water. So how you're going to explain it is you have the teeth, and it's going to go in and vibrate and wash in between there. It's different than manual, where they're going to go in and they're manually going to scrape things out. This one's a vibration with the machine. So they're different. Okay? So you do want to describe more about that. Okay. More terminology here. Broken tooth, cracked tooth, right? There's a difference there. A broken tooth, be like, oh, I'm missing a chunk of it. A fissured tooth or a crack there. The tooth is there. It just has damage to it. Has a crack in it. That's funny. So there's three. Um, so if you're chewing something or grinding their teeth or clenching, if they're chewing or grinding like this, you show like this. Where they're using these three words, right? Clenching, they're clenching their teeth. This one's very similar to clenching. It's the same. They're really clenching or grinding their teeth. And then TAPAF, TAPF, where they're like tapping their teeth together or chattering them almost. Most of the time, the dentist will say, you're doing one of these. So you have the basic concepts here that you can interpret. Braces or Invisalign. Typically, those are just fingerspelled Invisalign. You can explain if you need to, like if the dentist is explaining what they look like, you're putting in a bracket there. You explain what they're going through. They're on your teeth, they're behind your teeth. You know, if your teeth are crooked, it's going to pull them straight. Or if the teeth are overcrowded, then the braces can help straighten the teeth out. Those are ways to show that. It's important that you understand the classifiers. And if you understand the basic concepts, then you can translate into classifiers and interpret into classifiers. Brushing. You have your two hands, you know, manually you're brushing, manual brushing. Or an electric toothbrush. Either one is fine. You know how to sign brushing. Flossing. There's four options there. Regular flossing, pick flossing. Typically, deaf sign that like this. Floss like this. You know, it's that shape, right? It looks like that Y, and it's that little flosser in that Y shape, and it goes up in between your teeth. A threader. You know, sewing, right? Sewing clothes. So the shape looks like that. So they draw this little loop. And what's that for? Guiding the floss, right? If I have braces, then I guide it through and it leads the floss through so I can floss under the braces. That way you can get to it better. And now really water picks are very popular. Water floss. Water pick has that label. Sometimes patients are used to that pick word. Technically, it is a water flosser though. You would just spell it. Okay? So I've explained a lot about the terminology here from the patient's side. So if you're interpreting for a patient, that's one thing. But you also can have experiences where you're interpreting for the dentist or dental technicians that are deaf themselves, right? So oftentimes you'll see a lot of terminology there that's very specialized. It's very heavy on theory, very different than natural, common vernacular. So I just want to throw out a few things here. You know, we believe that it's so important to have the basic concepts there. Adult teeth are represented. There's a number 1 through 31, 32. Sorry. Adult teeth are represented by the numbers 1 through 32 and the full mouth, if you're including the wisdom teeth. If there's no wisdom teeth, then it's 28. So it's important to know, the dentist and the dental assistant might say, oh, number 3, oh, number 15, whatever. So you want to know what number, if they're throwing out numbers, it's associated with a specific tooth. For kids, they're represented by letters, A through T. Remember, you always want to start on the right, upper, and work your way to the left, upper. Then when you move down to the lower, you're going to start at the left, lower, and work your way right, lower. So 1, 2, 3, 4, all the way around the upper. It's the same with kids. A, B, C, D, working your way around. Next, the teeth have surfaces. There's a surface on the tooth. And that's represented by letters. M, D, B, P, and F, L, O, and I. So let me explain that a little bit more. So the teeth have a shape, right? You're familiar with that. You can see, you can notice that yourself. So the shape is different. So the front teeth and then the back side, the back teeth, right? They look more like a box, big molar. So the front teeth, this is the front side surface of them. And what's the name of that? Facial. This is the facial. Typically, that's abbreviated to an F. Understanding that the dental terminology is it's not standardized. You know, they each might have their own way to abbreviate how they want to talk about it. They have their own terminology in each office. So it is not completely standardized, but there are some common terms. So let me back up. So the facial, right? We can abbreviate that to F. Then the back side of the teeth, the inside closest to your tongue, right? Closest to your tongue. This side is the lingual, or L. L for lingual, the inside closest to your tongue. The top of the tooth, my apologies. Incisal is the top. I. Now it gets a little bit more complex. So you've got the teeth. Now you want to try and envision your body. You have a median line that goes around the center of your body, right? A central line running through your body, right and left, separating right from left. So you have this central line running down your invisible line running down your body. And if your teeth is the line closest on this side, then the name is mesial, M-E-S, mesial. It's abbreviated as M. And if it's farthest from that line, from that central line, distal, abbreviated to D for distal. Okay? Is that okay with everyone? Great. Okay. So now the back teeth, the molars we're talking about, okay? Let's go back to those back teeth. They have a different shape. They're bigger. Closest to the cheek. We're talking about the side closest to the cheek. That's the brachial. It's closed, abbreviated as B. And the inside closest to the tongue, you know that one, right? That's lingual, right? We already said. Lingual. Closest to the tongue. Okay. The top, again, these are a different shape compared to the front teeth. The top of that is called occule, O. And it's a very similar concept, right, to that median line. So if this side of the tooth is closer compared to the back side, so whatever side is closer to that midline is the M, mestal. And whatever side is further from that line is the distal. Okay? Great. Good. So This is now a little bit more in depth when we talk about periodontitis. So it's time that we just describe a little bit more about what happens. What's happening in the mouth? Why is it bleeding? Why is it red and swollen? Why is that happening? So everything is about the gum and the bone. Okay? So let me explain. The gum starts to get sick. The patient doesn't care about they're taking care of them, they're brushing, they're flossing. They say, I don't need to do that. And the gum starts to get sick. It starts to bleed, it starts to swell. And if they just continue to not take care of their teeth, they neglect their teeth, it becomes worse. And what happens is the bone starts to degrade. So your tooth is like this, and the bone comes up to it here and supports this tooth. It holds it in place. It holds that tooth in place. The bone comes up and supports the root of the tooth. And then the gum covers that bone. Okay. So if that bone starts to degrade and becomes affected, the bone level degrades. And that causes the gum to recede as well. So the gum is flexible. Many times it doesn't just stay, right? And the bone doesn't recede and the gum stays. The gum is flexible. It follows the bone. So if the bone recedes, the gum will recede. So then typically that tooth becomes loose. It can fall out. So what's important to explain is that bone stability, they need to understand the basic concept of that. Any questions? Okay, great. Beautiful. Now we're going back to strategies. It's important that we clarify. It's important that the information and the instructions are clear prior to starting any procedure. If you don't understand something, if it's gone over your head, how can you relay that information? It's impossible, right? I understand that you don't have to be totally skilled or knowledge in everything. You're not going to, you're not going to become a doctor yourself or a dentist yourself. You don't have to know everything. That's not what we're saying. But you do need to have a basic understanding so that way you can translate that information properly and interpret that properly. If you're not sure, confirm. Confirm ahead of time. Oftentimes, things get messed up related to medicine or information, which is such important information. How you use mouthwash. I mean, if people don't understand, if they're not sure, then how do they pass that information on? It's complex. You'll notice too, it's a physical language. You remember where we talked about the dentist's hands? They're all connected, right? So if you have a patient trying to avoid or something is being blocked or their face is being blocked or they're squinting, you have to notice that. Pay attention to the deaf person's body language and make sure that the dentist understands, hey, this isn't working. You are the expert in this spot. It's your skill to come in and say, this communication is failing because of something's happening here. It's important that we understand and hold the comments. If the patient's got their mouth open, the dentist starts explaining something, even if it's short or brief, it's challenging. It's challenging to stop them. You say, sure, you have to be able to take the time, hold the information, and then pass it when it's a convenient time. You might have to explain it after that part is done. You can always go back and ask the dentist, you were saying something about this. Would you mind reiterating again when you're done, when their mouth is able to be closed and they can look and see? And then you pass that information again. It's so important that you work together. Dentists don't know about sign. They don't know about working with interpreters. Most of the time, they want to talk with you. They have to know that they need to make sure that they're communicating with the patient. You're there to pass information to that patient, not to have a conversation. So it's a part of educating the dentist. It's your responsibility somewhat to do that type of job. I know it's kind of, what do I do in that situation? It's, I'm not supposed to be educating anybody, but it is sort of your job. Otherwise things don't go successfully. So it is your responsibility to pass that on. And for that, like I said, again, you have to understand basically the theories and the concepts behind what's happening. You want to make sure that you have a clear explanation. It's important. You want to make sure that there's respect given and received between everyone. If you go into a dentist office, you can try to structure a partnership and structure a team relationship. You want to make the job easier for yourself. If you show up and you're respect to the dentist, respect to the patient, everyone can kind of interact more easily. I know that we talk about responsibility, right? And it's just very important that you are able to pass on that information and interpret correctly. You don't want to put your opinions out there. You do need to clarify everything anytime you don't understand something. So it's just really important that you interpret correctly. Make sure that if there's any misunderstandings, you clarify. Communication is key. That's your responsibility. A few tips for you all. Always arrive early. Why? So that you can have time to establish that rapport, make sure there's an understanding that you can figure out where you can stand. If possible, ask the front desk, hey, can I go in and look at the room ahead of time? Would you mind letting me in there to see it so I can figure out where I can set up my chair or a table or where the instruments are going to be, where the machines are going to be set up? That's so important. So then you know where you can stand or sit. If there's enough room, you can sit. You want to meet the client ahead of time. That's very important, obviously. You know that. The dentist, the interpreter is there to show them a lot of things. Your tone is important. You need to adjust your tone and your language to match that client. So meeting them ahead of time allows you to know, am I signing more ASL or am I signing more in English? And being able to match the tone, grammar, and vocabulary of your client. So now is more fun, right? I know we've been doing theories and concepts, and now we get to actually practice. Ready? Okay. So I need to pull this up. Hang on. Okay, I can see now. Okay. So I want to volunteer. Who's a volunteer? Who's willing to volunteer? It's fun. Come on, this will be fun. It's not about being right or wrong. It's just practice. Yeah, Contessa. Yes, thank you. My mistake. I apologize. Yes, I can avoid the finger spelling. I forgot. Okay, so Contessa. So what I want is for you to read the scenario, take your time, and then interpret that. You can interpret it, some of the words. It's up to you how you want to interpret it, but go right ahead. Okay, whew, it's in depth. All right, let's see. Yes, the cavity, yep. Great, good job. Yes, that was great. Wonderful. You did such a good job, really. Thank you. That was really good. Okay, so yes. You want to say the high right molar, the upper right molar. You're going to spell that. That's right. Yep, you're going to spell that. And then deep or deep cavity. Yep. You can use that C after you set up the initial finger spelling of cavity, right? Once you set up that C for cavity, then you can go more in depth. So, ooh, it's painful. It's touching your gum. Yeah. Ooh, that's painful. I'm sorry for you. And you're going to need a root canal. What is that? The teeth here, these are the roots of the teeth. They need to go in and clean those. Remove the gum, go in there and clean that. After that, after it's done with the cleaning, then they'll cover it up and seal it, and that'll be perfect. Okay? So after the root canal, yeah, and you do have to finger spell that. There's no sign for root canal, unfortunately. Sometimes people do RT or RC for root canal. You can try to establish that. It just depends. Some people are open to that, some are not. So after the root canal, when the roots are cleaned, then you will need a crown because that tooth is going to be weak then. So you will need a crown to cover it and protect it. Okay? And you're going to start to feel, they're going to start with numbing. And what's the numbing? What is that? Right? A shot, right? For numbing it. Novocaine shot, right? In order to make it numb. So the official word is to anesthetize. But patients use the word numb. Oftentimes people use the word numb with the patients. So you can say there's going to be a numbing shot. Pressure, they use pressure. Yeah, you're going to feel some pressure, but you shouldn't be feeling any pain. Yes, right. Everyone good? Any questions? Okay, great. Wonderful.
Okay, perfect. Any volunteers? Mm-hmm. Okay. Okay, you get it. Yep, yep. No volunteers. No one. I know, I know. I know some of you have the interpreters are working, but you can go and volunteer. Come on. Yeah, go ahead and try. Yeah, okay, come on. Yeah, good, good. Yeah. Yeah, go ahead. Okay, and that's why I added that situation there. So remember body language. It's a lot for interpreters and deaf. Maybe the dentist not so much. So if you see your patient, that they're in the chair and you see that they've got that body language of nervousness and their facial expressions look nervous, it can be the dentist that helps calm them. Also, they tend to kind of close their eyes or squint because they're nervous. When you get nervous, you kind of start closing your eyes there. So, so what can you do? Beck, what can you do? But yes, remember the patient's eyes are closed. What do? Can you tap them on their shoulder maybe, or how do you navigate that? Do you do a tap? Mm-hmm. Right, right. Mm-hmm. Mm-hmm. And it is very important to try your best to get their attention. In the event that there's interpretation, you have to remember the dentist is also speaking. The dentist is saying something. And I know it happens. It can happen in treatment, but you need to make sure you relay that. What if the patient is in pain and their eyes are still closed? So you do need to interrupt and provide that. Does that make sense? And so if the deaf cannot communicate, they're not speaking, or their body language is so important. It's more important than anything else. Being able to relay that information, being able to facilitate that information. The situation can be complex, but it is very important to make sure you include that. Also, remember about the glasses. The clear glasses are really important. If in the event the patient's eyes are closed, the interpreter can't see, and so you're kind of just interpreting, and the patient's eyes are closed. Well, how? How? So again, it's very important to ask for a clear mask, okay? And the next situation, who would like to volunteer here? Any volunteers? No volunteers. You can go ahead if you'd like. Okay, go ahead. Go ahead. Sure, sure, sure. Mm-hmm. 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 Yay! Beautiful, beautiful, beautiful. Yay! Round of applause. So why I added that is that that is actual vocabulary. However, it's important. What's important is cover, the insurance coverage. That's always a difficult challenge. And the second phrase here, it's a little strange, right? It's a little strange, but understanding that the insurance, so for root canal, insurance typically will cover around 80%, typically, or a few might cover 50%. And that information the front desk might have, if you know you've got something different, it's a little easier to relay that. But the crown, most of the time, it won't be covered or it'll be covered at 50%. If you know there's going to be a difference, it's easier to relay that information and interpret in the interpreting process. Makes sense? Yep. Okay. Mm-hmm. Yep. Right. Yes. Right. So it's very important. Communication is valued, especially in the healthcare field. There hasn't, improvements have been made for safety, making sure safety is where it's at. Also, empowering the patient. Wow. Yes. The dentist or the specialist, in the event that there is, wherever we are in the process, whatever the environment, the context situation may be, should make sure you're learning to understand that and relaying that information and making sure that that is matching. The interpreter should be ready. That's very important to study in advance. Be prepared to be ready to interpret more confidently and more proudly, having confidence in the knowledge that you have. so that you're not struggling, that you don't feel you don't feel awkward or doubt your skill. And the next one is partnership and collaboration. The dentist has to understand why the interpreter is there. They may not know. You're making it accessible for the deaf. So collaboration and partnership, understanding that you understand them, they understand you. Things are perfect. The mutual respect is there. It's it's there easily. You're able to go to the office, and it's just kind of like a reminder of, yep, we're working together. I work with this dentist, right? Okay, so I'd like to know if you have any questions for me, any feedback. Do not be shy. Go ahead and share your experience, your feedback, any questions. Just really, people are in the same situation. Some people experience different things. It could be similar, it could be different.
That is the perfect situation, but for dental appointments, they go by so quick, and the dentist just shows up, does their bit, and most of the time it's the assistant, the dental assistant who's there, and then the dentist just shows up when everything is ready. They just sit down, do what they got to do. So it is a little bit of a complex question, but you can. So remember that the dental team, the front desk does know most of the time how things go. They might not be super knowledgeable in how the process goes, but they do know about the process. And then remember earlier, we talked about asking to making sure that there's understanding, or so most of the time you can just they'll chat with you before the dentist arrives or when the dentist arrives. So the assistant can be there to be like, hey, like, would you mind explaining what happens next? Just to make it easier for me to interpret the process. So for light sensitivity, I've seen dark glasses being used. If we have patients who experience that light sensitivity and need the darker glasses, what do you do if they can't see you? Like they'll usually have their eyes closed. Okay, I see. So there's three kinds of glasses. There's the clear ones, there's the very dark ones, and then there's the orange ones. And those orange ones are for light sensitivity. So you can request those. That's good information to keep in mind. All right, no problem. Any other questions? Yeah, please. I don't have a question. I more wanted to say, so every Saturday, I go to the there's a deaf event or a deaf space that I go to, and then
Deaf Day.
so there's still a lot that I still need to learn, and I'm excited to see, what we can learn for next year. I'm just really ready to have more information and more understanding of the daily process and what we can do. Thank you. Yeah, sure, no problem. The next event, I'm sure you'll be teaching them. You'll be the expert in the room for sure. All right, no, definitely. All right, and congratulations. Thank you for joining, and I really appreciate that so much. So I hope to see you all at the next one. Any other experiences? Any other questions? No? All right then. We got to wrap up soon. So for my topic when communicating, yes, it is about the interpreting, but it's also that collaboration, that empowerment of the patient, because healthcare and health information, when you're just saying, it's fine, I'm just relaying the information, like, no, you do need to make sure that you're empowering the patient and the deaf community. They should feel empowered, and that's very important. It's really important to match that to make sure that there's a really effective communication happening in that event. So that's my topic. And this is me. And this is my project, the Deaf Smiles Project. I have YouTube, I have a Facebook. So if you want to join and learn more, support the project, I'm open to that. You're all welcome. Thank you all again so much for joining here, and we'll see you. Thank you. I really enjoyed being here. And then thank you so much for this presentation and this topic. I really am so intrigued and fascinated by the information. So wonderful job. Thank you so much. Thank you. Thank you very much. All right. Make sure everyone fills out the evaluation form, please. Thank you all.